I was invited to speak at the conference because of my review in clinical trials. Obviously, OCT is the big clinical trial outsourcing conference, so I thought it was a good opportunity to come here to talk to industry, biotechs, pharma, CROs and others about how we can improve commercial clinical trials in the UK. My presentation was reflecting on the review that I did for the government on how to increase commercial clinical trials in the UK. That took place in the first half of the year, so I was recapping that, talking about the problems and how we solved them, and then some reflections on what's happened since, some progress that we've made, some areas where we're still maybe lagging behind, and an opportunity to obviously have a Q&A with some of the audience and address some of their concerns. Yeah, I think the conclusion I had from the review is, first of all, commercial clinical trials are really important, and although they're only a relatively small part of our total clinical trial activity, they have an outsized importance for patients, for industry, for the NHS itself, and so it's a really important policy focus. It's the first thing. The second is we have to be realistic that despite having, in a way, a very good pandemic in clinical research, other trials were put on pause or didn't happen at all, and we need to rejuvenate the whole industry. So we've got to be honest about some of the problems we're facing, the slow setup times and so on. But then the review is all about having practical recommendations to government and all the other actors who need to make stuff happen, like the NHS, to make a difference in the short term, in the next 2 to 5 years. It's good. I've had a nice tour around the presentations, a look around the stalls and so on, a great turnout, so it's been really interesting, really fun.